Welcome to Here's the Thing. My name is Vince Nigro, and with us on today's program, we're very happy to have Jean-Paul Soucy.
Very happy to be here.
Yeah, thanks for being with us. And before we get into a lot of your background, like I call it in the sciences. You're involved in epidemiology. You're working on a PhD, which we'll get to. A lot of the stuff I can't even pronunciate. But I just on simple terms. Who was Jean-Paul in high school? Like, tell us a little bit about where you're from and who you were growing up and how you got involved in the sciences.
Yeah, so I grew up in Fergus, which is a little town outside of Guelph in southwestern Ontario. It probably wouldn't surprise you to know I was a bit of a science geek in high school.
Right. Yeah.
I was also fairly involved in my community. I was on student council, I volunteered in a nursing home. All those positive qualities I could attribute to my parents. They taught me well.
Was the sciences, when you were growing up and you were in high school, was the sciences something that always you gravitated to, and in the back of your mind you always said that it was something you would probably want to stay involved in?
So it's kind of an interesting story, actually. I always had my nose in the book. So my mom's a librarian, so she read to me as a kid, and so I guess that always stuck. So I'd always be interested in reading about all sorts of topics, including history and science and sociology, psychology, whatever, right? But I always gravitated to the sciences in high school. But actually, when I started my undergraduate, I figured actually I'd go to law school. I always enjoyed debating. Maybe I watched too many episodes of Law and Order, I don't know. So I actually started my undergraduate degree in criminology with the intention to go to law school after that. But after my first year, I switched into biology and later added a minor in math. And after that, I went into epidemiology to study infectious diseases.
So you eventually got to epidemiology, and it was at the UT?
Yeah, so I did my master's degree in epidemiology at McGill University, and now I'm doing my PhD here at U of T.
Right.
So for me, epidemiology was kind of the crossroads of a lot of my interests. So let me first explain in very simple terms what epidemiology is.
Yeah, that's what I was going to ask you. What is that?
So I usually get two guesses when I tell people that I study epidemiology. It's not a particularly common term. So those two guesses are, people will say, okay, epidemiology, that means epidermis, so you're a skin doctor.
Right.
So little knowledge is a dangerous thing, as they say. And if you're perhaps know a little bit more, you'll say, well, hold on, epidemiology, that's like epidemics, so you study infectious diseases. Right. And that's right. But in fact, epidemiology can be simply described as the science of public health. So we study who gets diseases, why they get diseases, and why, what determines how diseases are spread in the population. So we deal not only with infectious diseases, but also non-infectious diseases like cancer and diabetes. But me personally, I do work with infectious diseases. And so it's quite a diverse field in terms of what we look at. And so that's why it really attracted me, because I was interested in all sorts of things. I think, the social sciences, health, statistics, mathematics, infectious diseases, biology, all of these interests kind of converge at this crossroads that we call epidemiology. And
so you're working on a PhD in epidemiology at U of T.
Mm-hmm.
And is that a full-time thing, or do you also, part of your studies is doing the research and things of that nature? Is that part of the whole thing?
Yeah, so I'm fortunate enough to have a scholarship, the Canada Graduate Scholarship from the Vanier program that the federal government runs. And so that allows me to dedicate more of my time to research. I know lots of people do work during their PhDs, and that's a valuable experience. Maybe in my later years, I'll pursue that as well. But yes, it is certainly a full-time experience, complemented, of course, by teaching assistant positions and research assistant positions and things like this that we do to earn extra income. But research is certainly a full-time responsibility. And if you want to be successful in a PhD, you have to treat it like a job. Yeah. Especially, I think in our field especially, there's a lot of freedom in how you spend your time, which means that if you're not really self-motivated and rigorous with your scheduling, then it's quite easy to fall behind. So
Jean-Paul, once you finish your PhD, what's your next goal? Do you have an ultimate goal that you want to do?
So I'd like to work in research, whether that means it's in academia as a professor, whether that means it's working for an organization like Public Health Ontario, which is working to protect the public health of Ontarians and Canadians in general, or whether that means working for a think tank that does public health policy. So I'm also involved in the public health policy program at the University of Toronto. I'm not entirely sure yet, but I think I've caught the research bug, and I don't think I can necessarily leave that behind.
Do you, being involved in what you're doing, and you hear of all these other, we'll talk about Crohn's virus a little bit later, but
Sure.
You hear about all these things like Lyme disease, and people never knew what Lyme disease was, and you hear new things that come up all the time. Are a lot of these new diseases things that were always around, or are they diseases that are new diseases? I guess with a bigger population, you get involved with more of possible diseases and that thing. Is it always been this way, or have there been new diseases?
Well, I think the answer to that question is both. So Lyme disease in particular, it was only described, I believe, in the 1970s.
Right.
In Old Lyme, Connecticut, so that's what it's named after. But it's believed that the disease was based on genetic evidence that the disease has been actually around for a very long time. It just wasn't particularly recognized. That's partly because we're more adept at recognizing diseases now, and also we've had an enormous spread of deer and ticks across the landscape, and that means that people are coming into contact with these disease-carrying ticks more often.
More often.
In terms of other diseases, so you mentioned coronavirus, that is a new disease, but there's been many diseases like it before. Of course, SARS is one that's burned into the Toronto consciousness.
Right.
But there's also diseases like HIV, which was only recognized a few decades ago, but based on genetic evidence had probably been circulating in Africa for at least a few decades before it was recognized by researchers, and that's because there's more global transport and travel, so these diseases can escape their relatively remote confines. And we're also increasingly moving into habitats with various animals, which means that we're having more of that contact with animals when we move into their habitats. And a lot of the new diseases actually jump from animals to humans. So the more contact you have, the higher chance you have of spreading those diseases. And now that we have these huge global transport networks, there's a higher chance of these diseases leaving their remote confines and actually making it into the public consciousness.